the Family Provider Partnership in the Primary Care Medical Home.
Hi, my name is Angela Paxton, and I'm the parent representative on the Indiana Medical Home Resource Team. I'm also a parent of a child with special health care needs. In addition to numerous specialists, therapists, and other providers, my family has a good relationship with our pediatrician, Dr. Gary Halberstadt, which I consider my daughter's primary care medical home.
According to the American Academy of Pediatrics, the medical home is the model for 21st century primary care, with the goal of addressing and integrating high-quality health care promotion, acute care, and chronic condition management in a planned, coordinated, and family-centered manner. So what does a medical home look like?
It is essentially the partnership between myself, my daughter, and my doctor that assures good communication before, during, and after office visits. One example of this is when my daughter needed a flu shot. Dr. Gary's staff were able to accommodate my schedule requests in a short period of time. Coordinating with specialists and other health professionals. When Maddie visits her geneticist, I check to make sure Dr. Gary's staff has received paperwork on the specialist visit. This can be important if there is a new diagnosis, change in treatment plan, or a change in medication. Sharing of health education, family support, and community resources. When Maddie was diagnosed with developmental delays, Dr. Gary was the first one to tell me about First Steps, Indiana's early intervention provider. Avoiding the ER for unnecessary visits. I know what number to call if I have a concern after hours. There should be no need to visit the ER unless it's truly an emergency. And finally, preparing for transitions and future health needs. When my daughters finish high school, they'll transition to an adult doctor. Families have described the Family Provider Partnership in the following way. Family members and professionals working together to ensure optimal services, recognition and respect for the knowledge, skills, and experience that families bring, as well as the provider, open communication and trust so families and professionals feel free to express themselves. Dr. Gary and I have a mutual respect and trust for one another. We work together to give my daughters the best care. When we are discussing new treatment plans, tests, or medication, there is truly shared decision-making. Finally, one more point, cultural traditions, values, and diversity of families are respected, acknowledged, and honored. Families come to the practice with different life experiences and cultural backgrounds. It's important to understand these differences and expectations around communication and decision-making.
The partnership between the family and provider is two-way. As a provider who believes in patient-centered care, I can help build a relationship between myself, my patient, and their family. A diagnosis is given, a plan is made. The family and child with special needs partner with their doctor. As primary care physicians, we are the link to the community. Our office provides the connection to available resources. Referrals are made to subspecialists, community support groups, and financial assistance when necessary. Special needs are not to separate a child from his peers. Summer camps and mainstream schooling are two ways to emphasize inclusion and promote development with our patients. If a child has a chronic care condition, a care plan is made now and for future health needs. The Family Provider Partnership gives the comfort of home.
Thank you.